Okay, so starting my third one or second one, I guess, for dressing change with Kendall Barker. I'm going to go into my client's room right away and introduce myself and assess for factors and the need for pain. So entering the client's room, I'm going to perform hand hygiene for some privacy. Hi Kendall, my name is Orea. I'm going to be your nursing student today that's going to change your wound. What is your level of pain? I'll do a full PQRS and assess her need for an analgesic before the wound care change and allow enough time for that to be effective for her. I'm also going to be assessing her for any other factors that might be inhibiting her wound healing, such as comorbidities, her decreased mobility, her nutritional status, if she's a smoker, her age, anything like that. And I'm going to be asking her for her full name and her date of birth. Yeah, Kendall Barker, and your birthday was in the 25th of June 1971. Good. Okay, so I'm just going to go gather all my supplies. So back in my nursing notes, I'm going to be checking my MAR, my nursing notes, and any of the wound care notes to see what wound care products has been used and what my findings might be with her. Okay, so I'm going to gather all of my supplies now and bringing this with me, making sure I get the right supplies. Yeah. Okay, so I've gathered all of my supplies. Let me make sure. So I have 2 pairs of gloves, normal saline pad underneath her abdomen if she needs, and a new sterile wound dressing kit. And I did grab a new dressing for her. Oh, there it is. And some gauze. Okay, so I'm going to enter back into the client's room with all of my stuff. I'm bringing my table with me. So now I'm in the client's room. I'm going to make sure she is ready for her wound care. If you need to go to the bathroom or anything beforehand, you're good. I'm going to make sure her bed is at a height that's appropriate for me and above waist level. Can I get you to say your full name and date of birth for me again? Okay, good. Perfect. Kendall Barker, 1971. I'm going to set up my sterile dressing field facing the client and above my waist to maintain sterile technique. Okay, I'm going to expose just the amount that I need. Actually, I'm going to come over here. So now that I have good access to the wound and she's all set up and ready to go, I'm gonna set up my sterile field. So, making sure this is above my waist, which is good, and making sure I have all my supplies ready. I'm going to put this underneath, just in case I get any drips of saline. Okay. I would just be putting my gloves on now and to maintain that they're sterile. Okay, so my first tab I'm going to put away from me. And then using my forceps, I'm going to pull these out. Trying not to do any unnecessary reaching over my thing. And then the last tab I'm going to pull away towards myself as I step back. And then I'm going to turn it. Okay. So now I'm going to take this extra sterile field and put it away because I'm not going to need it. Some extra gauze. I'm going to put that there. Okay. Take out my forceps, making sure that they stay within my 1-inch border. And always pointing my forceps down. Here's my garbage bag that I'm going to set up. I'm going to ask Kendall if it's okay if I just kind of put the garbage bag right next to her wound so we have easy access to it. Just going to put that right there, Kendall. Okay. Sure that is gone. I don't think I'm going to need extra. All right, so now I'm going to finish setting my sterile field up with my normal saline, checking that it is normal saline, and knowing that this is not considered sterile outside of this. So I'm going to turn that around and put it in one of my little compartments, making sure not to splash or spill anywhere or touch the edges. And put just enough in to clean my wound. Okay, and then setting that aside off my sterile tray. Okay, now that I have my sterile tray all set up, and I still have the same gloves on, I'm going to take off her old wound bandage. Okay, I'm gonna be assessing to see if she has any pain, and I'm gonna be taking off the edges of the tape around. And as I pull this old one off, I'm noting the amount of exudate on there. So is it saturated? I would say it's saturated, it's coming through. You can see, I'm gonna note the type of exudate, so it looks a little bit pinkish, so probably Serous sangrenus, a little bit of yellow around the side, so it might be a little purulent. I'm gonna note any odor that's coming off of it. And once I've noted all of this, I'm just going to fold that up and put it into my garbage. At this point, I'm going to take off these gloves because they're no longer sterile, and I'm going to start my sterile cleaning process. So I'm going to perform hand hygiene again. And then I'm going to put on a new set. Okay, with my two clean forceps, I'm gonna take one gauze at a time, and I'm gonna just package them up into little bundles. And I'm gonna soak that in the normal saline. So on the wound, I'm going to be cleaning it from area of cleanest to dirtiest, also noting where the gravity is going to be taking the water, the saline. And I'm going to be doing one swipe per swab. And as I go over, I'm just going to check the bottom of this, make sure that what kind of exudate or anything is coming off or sloughing off, and then just drop it into the garbage. I'm going to repeat that, making little bundles, putting them in my saline, and going again, one swipe per swab, noting, and once it's clean and I'm happy with how much I've cleaned it, I'm going to then dry. So again, taking the swab of gauze, clean gauze, folding it into a manageable bundle, and then this one's dry, and then just swiping or dabbing in the same direction, making sure that everything is clean and nothing else is coming off. At this time that I'm cleaning it, I'm also noticing what the incision looks like. I'm going to count the amount of stitches. So here I see 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. 12 stitches. They all look like they're in place. It doesn't look like any is missing. On the left hand side right here, it looks like there might be a little tiny bit of dehiscence separating just at the second stitch. I'm also noting what the peri-wound area looks like. Is there swelling? Is it a little bit red? Below the incision, it looks a little bit red, and right on the corner. Noting if it looks emaciated, if it looks waterloggish, but I don't see any of that. It actually looks quite well. Once I'm happy with it cleaned, dried, and my assessment of the wound, I'm then going to, using sterile technique, open up my new dressing. Okay, so the top of this dressing is open to the air, so that is not sterile, so I can touch that. I'm going to garbage that. But now the bottom is, so I want to take this flap and I'm going to put it, making sure I measure it, that it's going to cover all of it, okay? And I'm going to lay this down. Using light pressure and making sure that there's no wrinkles, and then taking this flap without touching the bottom and folding it over, smoothing it out as I go, and making sure all of the stickiness adheres to the skin. And then I'm checking in with my patient to see how she was doing for that process, see if she needs anything, and if she is happy with that, I am going to start cleaning up my field. So packing up all of this stuff and emptying my field. And then before I leave the patient's room, after I've cleaned up, I'm going to assess the need if she has to use the bathroom to avoid, if she has any other questions about the wound care, and I'm going to provide patient education and answer any questions about the need to keep it sterile, what the protocol is, and then anything else that she might ask. I'm going to lower the bed to an appropriate level, make sure her call bell is within reach, and then I'm going to exit the room and I'm going to go document on the wound care sheet and on my nursing notes any findings that I might have had.